Should we start?
Sure.
I'm going, Dr. Gersh. It's 59, so we can just simply go a minute early. All right. Hello, welcome, Dr. Gersh. Thank you again for coming in, and please accept my sincere thank you for joining in today. We are very excited, and we will wholeheartedly welcome our community to this one-of-a-kind 1 hour time where Dr. Gersh, who is already very unique, will share her wisdom on women health and happiness. So let's see how the people going, and we can start uh, the session. It's already noon, so we will go ahead and start.
Well, it's my pleasure to join you here today. It's such a new time that we're all living through, and it's wonderful that we can have this community to talk about this really important topic about the uniqueness of women in the era of the coronavirus.
That's so true, so true. And as we discussed earlier day when we met for a bit, that sometimes that's like maybe the nature. This is how we are built, that we can take care of everyone. When it comes to personal care, we normally ignore ourselves.
All too often, that is the case.
Would you? Hmm. Let's see, I don't know, this live video has ended, it says, so not sure what happened. So let me go ahead and see again.
Would you like me to put up my slide deck at this time?
Not yet, not yet.
Okay.
I don't know why the live video has ended. Are you still there?
I am here.
Okay. So let me start again. I don't know why it's giving me the error that it's ended. So I'm going to go ahead and start again.
Sure.
Okay. All right, we are starting and we will start with the introduction now. So are we ready? Dr. Gersh, can you hear me?
I am totally
Okay,
ready.
okay, perfect. All right, so at this time, we will begin our session officially. So welcome, Dr. Gersh, and welcome each and every one of you. Thank you for joining in today. And here we are to empower each other. And Dr. Gersh is a one of a kind, a medical doctor, and I'm very thankful to her for stepping in today and supporting and accepting my request to be live today on Facebook. So I would sure like to tell a little bit about Dr. Gersh, and then I will give charge to Dr. Gersh, who then she will just continuously will share her wisdom and will take any of your questions you might have. So we both welcome each one of you who are today watching the live stream. So Dr. Gersh, so a little bit about Dr. Gersh. Felice Gersh MD is a multi-award winning physician with dual board certification in OBGYN and integrative medicine. She is a founder and director of integrative medical group of Irvine, a practice that provides comprehensive healthcare for women by combining the best evidence-based therapies from conventional, naturopathic, and holistic medicine. She taught obstetrics and gynecology at Keck USC School of Medicine for 12 years as an assistant clinical professor, where she received highly coveted Outstanding Volunteer Clinical Faculty Award. She now serves as an affiliate faculty member at the Fellowship in the Integrative Medicine through the University of Arizona School of Medicine. She's where she lectures regularly, grades in the case presentation written by the fellowship students for their final exams. Additionally, she is a sought after medical forensic expert and has worked on numerous high profile legal cases. Wow, that's impressive. Felice Gersh MD is the best-selling author of PCOS SOS and PCOS SOS Fertility Fast Track. She is a prolific lecturer and has been featured in several films, documentary series, including The Real Skinny Fat and The Montel William, and also The Fasting with Walter Longo, PhD. With that, let's welcome Dr. Felice Gersh.
Well, it's my pleasure to join you all here. And I put together a little slideshow that I thought I could share, and hopefully we'll have some fun. So let me go ahead and bring that up. Okay, so let me make sure it's working.
Yes, we can see your slides, Dr.
I
Gersh.
see it, but it's not changing. I'm not, huh. Let me try it, this one. It didn't, the slides are not changing right now.
Oh, really? You should be able to
No,
advance. If you're sharing
I
in your
know.
Zoom, you will see in the bottom left corner, you will see the arrow which can take your slide to the next.
Ah, got it. Okay, thank you. I was using the computer. Okay, great. My biggest fears are now over. That's all just getting set up. So the topic for today is looking at the unique issues affecting women during this era of coronavirus so that you can optimize your health and, of course, your happiness. So let's look at some of the unique things about women. Well, let's talk about this special time that we're now facing involving this coronavirus that has been labeled the SARS-CoV-2. It's really a novel coronavirus that has literally hijacked our lives, not just in the US, but across the world. Well, here's a fundamental premise that every woman, every man as well should know, that in order to be healthy, to really handle this infection that has now really changed, like I said, everything on earth, you have to have optimal hormones. I don't really hear a lot of discussion anywhere about the issue of hormones. And in fact, the differences between males and females has really been just glossed over. But the reality is that our critically important immune systems, what actually will determine how your body will handle an infection with the coronavirus, should you happen to be infected, depends on having an optimal immune function. That requires optimal hormones. So let's look at the incidence of infection by gender, by sex. Well, if you look at this, you can see that overall, and this is data from New York City, the hotspot of the US, that there's not that much difference. It's a little bit higher rate of infection among males, but it's very, very close. But if you look at mortality rates, they're really tremendously different. Looking at the data once again from New York City, the coronavirus is killing men at twice the rate of women. But it still must be understood that twice the rate means that 1/3 of the victims that succumb to the coronavirus are female. But let's look at why is there this difference and what can we as women do to optimize our inherent, we'll say, advantage. Well, here is some data going back right now in New York City. As of a week or so ago, you can see the data. And looking back, all the way back to 1998, it was really no different. When you looked at sepsis, this like generalized infection in the body, that men survived at a much lower rate than women. And we'll see why that is. Well, it turns out that the secret weapon that women have is our estrogen, that dominant hormone made by our ovaries during the reproductive years. And I'm not going to go into it in great detail, but we also have another secret weapon. It's actually our extra X chromosome, which has many additional immune controlling genes that stay active. On the one that gets deactivated actually still has about 15% of genes still active, almost all of them involved in immune function. So going back, we have found that estrogen, this amazing hormone from our ovaries, actually can suppress the overwhelming inflammation, but it also works to improve the initial inflammatory response that allows women to survive an infection better. So if we look at estrogen, when you have enough estrogen, you have everything working. We have what we call metabolic homeostasis. And look at, these are not all the organs that estrogen impacts. Basically, estrogen has receptors on every organ in the body. So if we just look at here in the brain though, if you have enough estrogen, everything is right. You have proper energy balance. When you have fat tissue, everything is right. And we know now that fat tissue, adipose tissue, is very hormonally active. It's not just there as a source of extra energy when you need it by breaking down the fat. It actually is metabolically active. And then of course the pancreas, the liver, muscles, and our immune cells. Every immune cell in the body has estrogen receptors. But look what happens if you don't have enough estrogen. You have all these metabolic problems. But if you look through, you see inflammation showing up repetitively. Estrogen maintains our immune system functioning optimally to control inflammation. Now, if we do not lead the proper lifestyle, if we become obese, if we have a body filled with endocrine disruptors, the different chemicals that we're exposed to in our personal care products, cleaning products, and of course, plastics, stain retardants, and so forth. If we have a body full of those kinds of endocrine disruptors, and if we go through menopause, even if we do everything right as females, we inevitably will have to go through, and we lose our ovarian production of estrogen. When this happens, we develop systemic inflammation. And now we know that having this underlying state of inflammation is what really puts people at risk for mortal danger from this coronavirus. Because when you live in a body that has chronic low-level inflammation, it means that the immune system is not capable of functioning optimally. And when that initial strike hits, when that coronavirus enters the body, like through the nasal passages or the mouth, the immune system is not able to properly mount an inflammatory response to get that virus under control. So let's talk about what is this magical estrogen that we have in our body. Let me show you here. So estrogen is one of the steroid hormones, and it has, as I mentioned, receptors everywhere. It deals with kinases, rapid responses, and controls the production of many proteins in our cells. But estrogen is not often thought of in the major terms that it plays in the body. A lot of people think that estrogen is just about reproductive functions, but it turns out that estrogen is the earliest of all the steroid hormones that has been in the human body. The ancestral estrogen receptor goes back 500 million years ago. Estrogen is about metabolism, it's about survival, and it exists in creatures that have no reproduction that's even like a human type of reproduction. Estrogen is the metabolic hormonal glue that connects reproductive functions and all of the functions of the body, which includes immune function. And in fact, as you can see here, estrogen receptors regulate innate immune cells and all the signaling pathways. Without adequate amounts of estrogen, your immune system simply cannot work properly. And let's look a little bit here. Now, what this is looking at is the P stands for progesterone, E2 is estradiol, the estrogen from the ovaries, and A stands for androgens, like testosterone. The up arrow means that it's increasing the inflammation. The down arrow means it's decreasing. And if you look under E2, the estrogen, it shows all of these different types of inflammatory products that are involved in an inflammatory response. Now, we need these initially, but what happens is once you get inflamed, like with coronavirus, if these inflammatory particles go out of control, you can't control what happens in the body, and you could get a cytokine storm, and you're not really having proper killing, or actually in this case, that's not for bacteria, or deactivation of the virus. So estrogen is actually an immunomodulator. It actually controls the production of the inflammatory products of the cells so that the immune cells are there to act vigorously against the initial infection, but then when the infection is actually under control, it calms down the inflammation process so you don't end up with uncontrolled inflammation, which is what is happening in many of the victims who develop the cytokine storm. So far, over 230,000 people worldwide have died. And how does this virus work? It actually gets into the cells through a receptor that's on many, many cells in the body, but heavily in the mouth, the nasal cavity, also in the lungs, but many cells have this receptor. It's called ACE2, angiotensin converting enzyme 2. Now, it turns out that this receptor actually is the beginning of the anti-inflammatory pathway. Our bodies are beautiful. It has the balance between pro-inflammatory and anti-inflammatory. In order to go from the inflammatory response into the resolution of inflammation, you need to have functional ACE2. And what happens is the virus, this coronavirus, gets in and binds in the membrane, the cell membrane, with this enzyme, creating what is called a functional receptor. It actually then blends into the membrane of the cell, hijacks the cell, causes reproduction, replication of the virus, and impedes the body's ability to down-regulate the inflammatory response. Well, I don't want you to have to feel like you have to learn all about this, but this is part of the system that enzyme that is hijacked into and turned into a receptor for the coronavirus to enter the body. It's called the RAS system, renin, angiotensin, aldosterone system. And it's played out in many organs of the body. And when it gets dysregulated, it actually leads to chronic metabolic problems like cardiovascular disease, hypertension, diabetes, kidney disease. But you can see that it has the blue shows when everything is working properly. The red is when things are not right. And what happens when the coronavirus gets in, it makes it so that the only part of the system that keeps working is the inflammatory part, not the anti-inflammatory part. Now, here it shows this is the ACE2 receptor leading into the anti-inflammatory portion. that, and it shows that when everything is right, what happens in the body, you can see that you have all these good things happening. And then on the bottom, when it's dysregulated or blocked, that's when you have all the different problems that occur. And it shows like increase of NF kappa B. NF kappa B is a transcription factor that is behind the production of all those inflammatory cytokines that can hijack the body's functioning and cause that cytokine storm, which causes the whole body to become inflamed. The blood vessels become inflamed. People can have diffuse blood clotting that we now know about. This can involve different organs, the brain, the kidneys, the heart muscle itself. And all of this is how it's being hijacked by this coronavirus. But guess what? Estrogen to the rescue. I want you to look at this. Estrogen can actually override this system. CE2, that's estradiol. If you have estrogen in the body, or perhaps for menopausal women, if we give estradiol, what do? You can actually block this entire process of the coronavirus, which is overcoming the body's ability to downregulate inflammation. So this is so key. I want you to see that red is estrogen and how it blocks this process that occurs when you don't have. You see, it says aging in females. Now here, this is talking about aging, but the same thing would apply with if you don't have enough estrogen and you get the coronavirus coming into the cells. And then you have increase in NF kappa B, you're going to have all of these, you're going to have increase in the inflammatory type of nitric oxide, and basically you have tremendous harm throughout the body. On the other side, you have the anti-inflammatory, which is controlled by estrogen. So this is so important that most people have no idea that estrogen can actually tremendously help to prevent all the harms that come from the coronavirus. Now, this is a very, very interesting piece of information. We are diurnal creatures. What does that mean? We are day creatures and we are not night creatures. We don't function well at night. We're supposed to be sleeping. And our immune systems are very circadian. We have these beautiful rhythms in our body, and it's not well recognized that the immune system is very circadian. And it turns out that estrogen is very important in controlling our circadian clock. So SCN stands for suprachiasmatic nucleus. That's the group of neurons in the brain that sits atop the hypothalamus that connects to the optic nerve that senses light. And you see it says ER beta. That stands for estrogen receptor beta. So there's different receptors for estrogen, alpha, beta, and membrane. But as you can see, this is in the brain. You have estrogen receptor alpha and beta, and this is showing it relates to reproductive function. So you can see a uterus there. But estrogen is about everything. It's about reproduction, and it's about all of metabolism. And that's really key to know, because the circadian rhythm isn't just about reproduction. It's about everything in the body, including immune cell functioning. And here you can see that everything in the body is circadian, how we put out urine, the blood flow to the brain. And look at that blood flow to the brain at night. The middle of that little gray vertical column is 2 a.m. See, it says O2, 2 a.m. That's when we have maximal blood flow to the brain. So if you're not getting enough sleep, which we're going to touch on, then your brain isn't getting the rejuvenation it needs from having proper blood flow. And as you can see, melatonin peaks at 2 a.m. Cortisol dips at 2 a.m. And our blood pressures go down during the night as well, and as does our temperature. Sleeping is very important. Our bodies are programmed by the 24-hour rotation of our earth, and that is key to health. And estrogen is key to maintaining the proper rhythms of our body. But look what happens when we do the wrong things, when we don't go to bed at the right time, we don't eat at the right time. The clocks in our brain get dysfunctional, and so do the clocks elsewhere in the body, particularly in the GI tract, which we now know have a tremendous impact on our immune it turns out that there are clock genes throughout the entire body. All of our organs have clock genes, and they are programmed by the time we eat, as well as by the master clock in our brain that senses light and dark. So everything in the body is coordinated. All of our organs work together to function properly and gives us proper immune function. And if we look here, you see it says ovarian clocks. Yes, if women do not get proper sleep and eat at the right times, their ovarian function is off. They will not make estrogen properly. And if they don't make estrogen properly, they're not going to have proper immune function. This is really important because if we don't take care of our beautiful hormones, our body cannot function optimally, and we will become at risk of infection from coronavirus having a more dire outcome. Now, the gut microbiome is really important in terms of how it manages our body's immune system. It turns out that all the little cells in our gut, those trillions of cells, each have clock genes. And how do they know what time it is? They only know what time it is by when you eat. But it gets even more complex because if you don't have the right amount of estrogen, like if you're in menopause or you're eating foods that interfere with the proper gut microbiome, for example, if you're eating chemical foods, if you're not eating organic foods, they can alter the microbial population, and that will change how your immune system works. So it turns out that the circadian rhythm and the immune system are tightly linked, and that it matters tremendously about how the gut works, because it turns out that 70+% of all the immune cells in the body are gathered around the intestines, and they are communicating with the gut microbiome. The microbial population in the gut communicates with our own immune system. But if things are not right, if you don't have enough estrogen, if you eat the wrong foods, like toxic foods, or if you don't nurture them, then you get barrier dysfunction, you get the wrong bacteria, and it promotes inflammation, which we now know will alter the way your immune system can respond to critical infections. So this is so interesting. This is a study that showed that menopausal status changed the gut microbial population. And we now know, as I said, the bacteria that live in our gut controls how our immune system is going to work, because it communicates with the immune system through the wall of the intestine, and everything is altered when you have an altered, inflamed kind of gut microbial population. And here you can see, I want to point out that after menopause, you have an increase in inflammatory cytokines circulating in the body, correlating with an increase of certain bacterial types in the gut, like Prevotella. Now, here's something fascinating. They did a study in China looking at the gut microbiome of people who were infected by the coronavirus, and guess what? Prevotella was more prominent in their microbial population. The same microbe that increases in women after menopause. And after menopause, women tend to have more impaired gut barrier function, leaky gut, and inflammation. It's all linked. It turns out that the coronavirus alters the gut microbiome to make it more like a postmenopausal woman's, and that is bad. And so what do we want to do? We want to make sure that we have enough hormones, and we want to nurture our gut microbial population. And here it shows if you don't eat at the right time, we call it chrononutrition. If you eat at the right time, or if you don't eat at the right time, different things happen. And it's not just when you eat, it's also what you eat. So skipping breakfast and eating late at night is going to give you desynchronization, and you're going to have more inflammation. And of course, inflammation drives metabolic disorders like obesity, which is associated with higher risk of coronavirus bad outcomes. Now you can see how everything is linked together. And it turns out that our toll-like receptors, these are the receptors on the immune cells that actually detect the bacteria and viruses that are trying to invade our bodies, are also circadian, as is every function of the gut. And as I want to remind you, all of these are impacted by the amount of estrogen you have in our bodies. So that's why estrogen is the magic that helps women to have the higher survival compared to males, because males have far, far less amounts of estrogen in their bodies. And when you have the gut microbial population that is wrong, you see you have all these metabolic dysfunctions. And if you drop down to the bottom, you see the purple side is the obese, dysbiotic side. It shows inflammation, oxidative stress. And that's what drives the body's inability to deal with coronavirus. So menopause creates an added oxidative stress burden. I don't want to go over this in detail, but I want the take-home message to be that when you don't have enough estrogen, like low estrogen, you drive the inflammatory portion of the RAS, the renin-angiotensin-aldosterone system, gets driven to go into that inflammatory state. When you have adequate estrogen, you can balance it. But if you don't have enough estrogen, that's a huge problem. All of women go through menopause. The incidence of mortality from coronavirus is dramatically higher in older women than in younger women. That's not an accident or coincidence. It's because of their loss of estrogen. So this shows that when you do things wrong, like you eat the wrong foods, that you're eating junk foods and you're not eating the right foods, like foods that have enough omega-3 and antioxidants and polyphenols, you get this terrible raging gut inflammation and you get leaky gut. And if you go down, see it says infection susceptibility. It all links to your estrogen, but also your lifestyle choices. It's not like you have no control over anything. And in fact, you do have control over a great deal. You can't control your age, your gender, your race, your menopausal status, your family history. Of course, you can't. But look at all the things that you can control. You can control what you eat and when you eat, how you deal with sleep, and how you deal with all the other circadian rhythm influencers, like getting sunlight or turning the light on and leaving it on all night, or watching blue light like devices like computers and televisions before you go to bed. You can handle stress and you can add physical activity, which is amazing for reducing inflammation. And if you're a menopausal woman, you can consider using hormones. And of course, smoking and drug use is not on our menu. So when you get a healthy microbiome by supporting your gut properly, you deal with all of these things to have ultimate health. And that's where we can have a real impact with the food choices we make. Even though we can't control our age, we can do a lot to feed and nurture our gut microbiome so that we do not get leaky gut and we do not start activating the immune system that lines our gut to create a lot of that inflammatory cytokines. So by eating a high fiber diet with lots of whole grains and root vegetables, beans and legumes, we are nurturing our little microbes because they love fiber. That's their food. That's how they get healthy themselves. And then of course, healthy fats. And we want to eat probiotic foods and prebiotic foods like kimchi and sauerkraut and other fermented foods. And lots of green leafy vegetables, as I said. And I would limit animal protein tremendously. We don't need a lot. If you would like to eat some, then I would keep it down to like 3 ounces a day. And of course, no refined carbohydrates or sugars. Keep alcohol out. It's a direct toxin to your liver and your gut. And of course, if you have food intolerances, you have to avoid them. When you eat is just as important as what you eat to keep your circadian rhythm functioning. And remember, I mentioned your immune system is completely circadian. For example, our natural killer cells are much higher in the morning. We have to realize that our immune system is really based on our 24-hour day, and it works best when we eat properly at the right time. That means not eating all the time, not snacking all the time, not eating late at night. You should try to have a 12 to 13-hour fast from dinner to breakfast. Don't skip breakfast. That's the time of day when our immune system is most active. That's the time of day when our insulin is most functional and we have the lowest insulin resistance. We have the most insulin sensitivity. So we have to work with our innate rhythms because we can't control our age, and we need to recognize that as we get older and our estrogen levels drop, we have to work that much harder to work through what I call the backdoor ways to try to keep our rhythm and our immune system working properly. Sleep is critically important. So you want to start dimming the lights long before you go to bed. Stop watching television, the computer, and doing things on the computer. If you can, look at the colors of the sunset. They actually help to suppress cortisol and bring up your melatonin production. Do calming things an hour before bed. Have some chamomile tea or similar, some holy basil, tulsi tea. Do some breathing exercises. Do your yoga breathing. Take a hot, relaxing bath. And then when you do go to sleep, make sure it's a very cool and very dark room. I personally sleep with a sleep mask to keep the real dark room sensation, because I can't keep the ambient light out of my room. And it turns out that even a little bit of light filtering through our eyelids can suppress optimal melatonin production. And we want to get some bright light every morning and in the midday to help keep our circadian master clock properly programmed. And stress can take care of our immune system in a very terrible way. It can damage it. Stress control is essential. So we're living in a very stressful time. There's so many ways to deal with stress. Find what works for you. My favorite is guided imagery, but there's so many, and you need to deal with this on a daily basis. Our immune system can be upregulated and become dysfunctional when we have chronic stress, and it will completely dysregulate our circadian rhythm, and it will alter our ovarian function. Stress can cause menstrual irregularities. I'm sure you women all know that. A highly stressed woman will often have irregular cycles. Oh, something happened here.
You good, Dr. Gersh?
Hang on here. Hang on one second, I'm not sure.
Okay, you can share.
Well, okay. Okay, well, I'll just go through. I don't know quite what happened there, it just disappeared. But basically, the things that I want to emphasize, we were almost to the end, is that endocrine disruptors, like in personal care products, need to be avoided. So you want to choose wisely what you put on your skin, and for cleaning products as well. And make sure as much as possible to buy organic, whole foods. We don't want to eat processed foods. I know at the very beginning of the coronavirus pandemic, when people were so frightened that all the food would be gone, that I went to the market and all the shelves that were cleared out were the ones that had all the processed foods, all the chemical foods. That's the exact opposite of what you want to eat. And the produce was all sitting there. So you want to try to have a lot of vegetable servings with every meal. Try not to snack in between meals, and consider hormones. Hormones, if you're in menopause, can be very beneficial. The scientific data is just abundant on the benefits of estrogen. So we have to remember that estrogen is there to protect us in every which way. It's the master hormone of the female body, the master of metabolic and immune functioning. And we have to do everything to maintain it healthy levels when we're reproductive by working with our rhythms and doing all the things that I said to have optimal ovarian function. And after menopause, we need to even work that much harder to keep our gut healthy and our immune system functioning optimally. And consider hormones, that's not the whole answer. It never is. You have to do all those other things. But by eating the right foods at the right time, by maintaining social connection, controlling stress, having love in your life, getting sunlight and fitness, you can, if you do get infected with this coronavirus, come out with no serious complications or problems. So women, we have that edge, we have that magical ingredient, estrogen, to help us, to protect us and give us that survival edge. So recognizing this and all the things our bodies can do for us will help us to be optimally healthy and happy through this coronavirus pandemic. Thank you.
Wow, that was impressive. I believe right just in time, and wow, fascinating. So we're just gonna pull out. Like if I'm gonna ask Dr. Gersh from you, if we can tell 5 topmost things we women can do during this coronavirus pandemic, then what would be your top 5 generic advice?
Okay, so the top 5 would be to get enough sleep, to eat whole foods with lots of fiber, to start eating at the right times, to have a good sized breakfast, a medium lunch, a small dinner, and stop snacking and don't eat at night, to get sunlight. People have been told by dermatologists to stay out of the sun. Of course, I'm not advocating for burns, but sunlight increases our body's ability to make serotonin and melatonin, and we make antioxidants in our skin. Of course, vitamin D, which is critically important to immune function. So we want to make sure we get out and get sunlight. I'm going to make it 6 things because the next one is fitness. We need to move our bodies. We need to,
Absolutely.
and then the last is to maintain love and connection, even with, social distancing. We are such social creatures. If we don't maintain love and connection, then we will wither. We know that probably the biggest risk in elderly people for having heart attacks and death is loneliness. So the social connection and the love in our lives, especially for we as women who are so interconnected with people, is critically important.
That's very good. So thank you, Dr. Gersh, for this wonderful presentation. And we have some viewers' question here. So I'm going to read those to you one by one, and I would appreciate if you can answer those.
Of course.
Okay, so we have actually one dietetic intern here. Her name is Becky Roberts, and we want to encourage these students to really learn. I always say, being an educator, that students needs to be forward thinker. So we appreciate Becky for coming in. So Becky is asking Dr. Gersh that you mentioned batch remedy in your slideshow. Can you please emphasize on that?
I'm sorry, what kind of remedy?
Let me go back to her comment. Yes, the batch remedy, BACH.
Oh, okay. So that's a homeopathic type of a remedy. And so we call them Bach flower remedies. And they're actually like the essences of flowers. And there was research done in Germany some time ago that Bach flower remedies can be amazing for dealing with a lot of issues, especially anxiety and sensitivity. They're very gentle and can be used on children. So Bach flower remedies, but you need to have training in that. But it falls under the category of homeopathic, although it's actually not exactly like homeopathy because it's actually using essence of flowers. So it's sort of a blend between essential oils, using hydrosols, like the water version of the flower and the plants, and homeopathy. So it's an interesting blend, but that takes study if somebody's interested in learning about that.
That's thank you. And we have another viewer question. Her name is Sangeeta Shrivastava, and I know her very well. Sangeeta Shrivastava actually by profession is a clinical psychologist, and what she is asking here, how to maintain healthy level of estrogen in our body and how we can determine the level.
Okay, so if you are a woman who is in the reproductive years, has so much she can do to maintain proper ovarian function. So the ovaries themselves can become inflamed. In fact, they've shown in women who have infertility, for example, they even unexplained infertility, that if they take fluid from around the follicles that hold the eggs, that there's actually an infiltration of white blood cells, inflammatory cells. So if you have an inflamed body, you're going to have inflamed ovaries. You're not going to make hormones properly. You're not going to make the right amount. It's not going to have the beautiful rhythm. So you really have to do all the lifestyle things as a reproductive aged woman. And the problem is we're seeing so much dysfunction in the menstrual cycles of young women because their diets are nutritionally deficient, especially in key nutrients, antioxidants, magnesium. As well, they are often staying up late at night. They have too much light exposure. They're not exercising. They're so sedentary. They have high stress. They're, not only not eating the right foods, they're eating toxic foods that increase inflammation. They're eating foods that don't nurture their gut microbiome. All of these things are going to translate into abnormal estrogen and, of course, progesterone, but estrogen is the dominant hormone, they're not going to be right. And so how that's manifested is with abnormal menstrual cycles. Women are coming in at all ages in their reproductive years, from teenagers to women in their 20s and 30s and 40s, up all the way up till menopause, from the start of puberty, with irregular menstrual cycles, PMS, terrible menstrual cramps, heavy bleeding, irregular bleeding. All of these are really flags, gigantic red flags, that the woman has inflammation in her body, that she's unhealthy, and that the solution is not to put her on birth control pills to try to cover up this really significant problem that's going on in her body. Rather, you need to do an investigation into all the different lifestyle components so that you can help this woman to actually optimize her health and, of course, her hormones, because they're one and the same thing. And it's so disappointing to me that most OBGYNs, they don't get it, that having optimally functioning ovaries, having proper hormones flowing through our blood vessels and into our cells is essential for optimal health, including, of course, optimal immune health, because it's one body. And instead, they just look at the symptoms and want to cover them up. And that is not the solution. That is because you're basically kicking the can down the road. This woman is not getting healthier. In fact, birth control pills alter things. They alter the gut microbiome to be similar to what happens in menopause. I showed you that you get the wrong microbial population after menopause when you lose your proper estrogen and your beautiful rhythms with the lunar cycle. That happens when women go on birth control pills. Their microbial populations change. This is out of research out of Harvard. They're more likely to have inflammation. It can worsen inflammatory bowel disease, and it lowers the production of T regulatory cells, those critical lymphocytes that help to calm the immune system so it doesn't go into a state of uncontrolled inflammation. So, this is, I'm sorry, I love your question because it's so critical that when women who are in the reproductive years understand, because often their doctors don't, that menstrual dysfunction is a sign. It's a sign of innate dysfunction, including their immune cells, including their liver, their gut, their vascular system, and their brain. That's why so much now is like with women having psychological problems, right? So much anxiety and depression in women. That is a sign that they have underlying health problems, and their gut is usually dysbiotic and their immune system is dysregulated, so they have neuroinflammation. Their brains are really inflamed, and that's why they have immune system dysfunction. So we need to all wake up and help all our family members, our friends who are women, understand that having proper hormonal function, the beautiful rhythms and hormones flowing in us during the reproductive years, is not just about making babies. Of course, it's about that too, but it's about actually having a healthy body in every sense of the word.
Wow, that's very interesting. So we have another question from Wenny Wang, who is also very young and energetic registered dietitian. And she asked when the COVID-19 antibody or the vaccine is coming. So let's just talk about the vaccine only. When the vaccine comes, is it safe for a pregnant woman to take the vaccine?
Well, the vaccine is a very fascinating topic, and there's a lot of concerns I have. Of course, it seems like that would be the ultimate in solutions, right? If we had a functional, effective vaccine, and hopefully that will happen. But there are things that are not happening with the vaccine that really should be taken into consideration. Women have very different immune systems than men. I didn't get into it in great detail, but because of our extra X chromosome and because of our estrogen, women have more immune cells. They actually have more neutrophils, more macrophages, monocytes. We have more actual immune cells. We make more antibodies than men. We have a more robust immune response, which is why we can kill off the coronavirus better when it gets into our body. We have a more robust immune system. Now, this also translates into a more robust response to vaccines, which is never considered. It's so terrible that females are not the same as males. Our immune systems are different. So much of our bodies are different because of our hormones and our extra X chromosome, but it's not considered. So they give the same vaccine to males and females. And females, for example, from the flu vaccine have a much greater response. Now, that sounds really good, except that if you get too much of a response, you can have more complications, which in fact is what happens. Women are more prone to getting autoimmune reactions and so forth from vaccines than do men. So I would pray, but I don't see it happening, that they would do a separate kind of analysis of a coronavirus vaccine on males and females, and also elderly people, because they really deserve different vaccines. It's not a one-size-fits-all immune system in our world, and I don't know why that isn't really taken into account. The elderly often have no response or very little response to vaccines. That's why with the flu shot, in order to try to get a more response from the elderly people, what did they do? They created the senior vaccine. What is that? It's just double the dose. So they doubled the dose of the vaccine and they called it the senior, super strength vaccine. But even with the super strength vaccine, the amount of response that you get from seniors is only increased by maybe 2 or 3%. It's almost negligible. So the vaccine that they're trying to create will probably have almost no impact on the elderly. They probably won't mount a response. And women, I'm afraid, will mount an excessive response and potentially have complications. And men might do better. And pregnant women, there will be no data because they're never going to do studies on pregnant women with the coronavirus vaccine. So I would definitely steer clear of it with no data, because it's really a challenge when you look at what's going on in a pregnant woman with the fetus, both parties, because the immune system is quite different in a pregnant woman because the estrogens are different. And when you have high levels of estriol, the estrogen produced by the placenta, it actually downregulates the immune response so that the immune system doesn't kill the baby as an invader. So women who are pregnant have more risk for certain infections because of their innate immune system being deregulated, sort of downregulated. But the fetus is actually just developing its immune system. And so we don't know that you're not going to malprogram it by giving something like a high dose of adjuvants and the deactivated virus. We don't know how that might impact on a developing immune system of a fetus. So at this point, I would certainly not recommend it when it first comes out. But of course, we'll wait and see what the official recommendations are. But what I really wish, and I just don't see it happening, is that they acknowledge the differences between the male and female immune systems, the elderly versus the young, and don't try to create a one-size-fits-all vaccine, because that's how you can get into really significant complications when you think everything's the same for every person. Another thing that's interesting about vaccines is that the time of day you give it can actually alter your response, because we have a circadian immune system. And so they really should not only look into the best vaccine, but what's the best time of day to give it. Because like I mentioned, in the morning, you have much higher numbers of natural killer cells running around. Is that the best time or the worst time? That's what we need to find out. When should you get the vaccine? That everything is about timing, not just about taking.
Oh, interesting. Wow, that time can also matter. So again, wait and see, such a new thing. So we just need to kind of see what comes out and then wait and see. So Dr. Gersh, we have another question from another community member, Sarita Singh. She's asking, what's the best solution for UTI?
For a UTI?
Yes.
Okay. Well, first of all, there's two things with a UTI. One, of course, you have to treat it in some fashion. And two, you have to think about why did this happen, right? Because we always want to think about the why. In terms of treating, we are not going to treat with antibiotics right out the gate, except in pregnant women. Pregnant women have a very significant risk of having the bacteria go up and infect the kidneys, causing what's called pyelonephritis. And that is very dangerous because you can get urosepsis, the bacteria can go into the bloodstream. So pregnant women, you have to be more aggressive with. But for other healthier, younger people, you don't want to jump into antibiotics right away. You want to try to hydrate, and you can use some like products like blueberry juice and cranberry, not with all the additives and chemicals and things, but that helps to prevent some of the binding. And as well, there are some herbals like uva ursi that can be naturally microbial, antimicrobial, that you can work with. So the vast majority of women, if you do this. And you can also give something like Peridium, something that will help with the pain, like a bladder numbing to help for first 2-3 days. And most women, their immune systems will help to get rid of this infection. Now, we have to think about like, why would you get the infection and who tends to get the infections the most? Well, our bodies have a certain vaginal microbiome, the normal bacterial population of the vagina, and the vagina protects the bladder. So all bacteria kind of enter through the vagina around the opening, then up into the bladder. So if you do not have a healthy vaginal microbiome, then you're more prone to having bladder infections. So who doesn't have a healthy vaginal microbiome? Well, old women. After menopause without estrogen, there's dramatic change in the bacterial population of the vagina, and that increases the risk of vaginal atrophy and antibiotic, bacteria getting up into the bladder and causing infections. Who else tends to have vaginal dysbiosis? Women who have multiple sexual partners, that they could get infections. They can get things that we don't even talk about as infections, but they really can be. They get altered microbial populations like ureaplasma, mycoplasma. These type of creatures can live in the vagina and alter the immune response. And then women on birth control pills. So it's known that women on birth control pills, just like they have a gut microbiome that's different, so too they have a vaginal microbiome that's different. That can increase their risk also of urinary tract infections. And then chemicals that put in the vagina. Unfortunately, different kinds of spermicides and materials in condoms. Some people still actually use a diaphragm. Things that are in tampons or menstrual cups can also alter the microbiome. Just like people talked about, not so much recently, like toxic shock syndrome. When you put in a tampon, you're altering the microbial population because you're introducing oxygen into the upper portion of the vagina, which is normally oxygen free and has a whole different population of microbes. So there's a lot that can go on that you have to look into as to why would you even have this infection in the first place. So that, because what happens, and I've seen this so many times, is that women, their reasons for their urinary tract infection are never addressed, and they go on so many courses of antibiotics over the course of a year. It's unbelievable. Like they can be on 5-6 courses of antibiotics because they keep getting recurrent infections, and they just go back to their walk-in clinic and they just get another prescription for antibiotics. And that is causing a great deal of harm throughout the body, because if you think about the word antibiotic, it's anti-life, right? It's a killer. And remember, when they invented antimicrobial, antibiotics, they didn't understand the critical nature and importance of our own microbial populations that live in and on us. And so by keeping them healthy keeps us healthy, and destroying them with lots of courses of antibiotics creates tremendous harm to our bodies. And in fact, just 5 courses of antibiotics doubles the risk of developing diabetes. So these are not insignificant things to consider.
Okay. Interesting. So we have another question, Dr. Gersh. Any suggestive remedies for overactive bladder?
Well, this is a real sad thing when people have overactive bladder. I call them bathroom mappers. Wherever they go, they have to find out where the bathroom is. Now, what's interesting is that they've correlated overactive bladder to early age onset use of birth control pills, oral contraceptives. So, and we haven't really figured out how to fix that. So it turns out that our reproductive systems, and that in our urogenital system, including the bladder, are not fully finished developing at the time of puberty. In fact, we now know, for example, the brain doesn't really finish developing until like the mid-20s. Okay, so it's still evolving. So our bladders, our vagina, those systems, those organs are still developing. Like if you looked at the body of a 14-year-old who's maybe had a period for 2 years, and you look at the body of a 35-year-old, even if she hasn't had kids, I mean, they're very different, right? The body is still evolving from age 14 to like 30, okay? So there's a lot of changes. The body, the breasts are still changing, the vagina, the bladder. And if you go on birth control pills, and this is so prevalent now because of all the things that I talked about that cause menstrual cycles to be abnormal, because basically the girl is not healthy, has a lot of issues with her health. And then so she has abnormal menstrual cycles, and they immediately put her on birth control pills. And she's like 13, 14, 15. if you go on birth control pills before your age at least 19, there's a significant increased risk that you will have problems with your bladder being like not distensible, because estrogen is about things being like stretchy. So for example, the vagina, if you were an old woman, like a 90-year-old, that vagina is not very stretchy. But in a young woman, the vagina is really stretchy. And then in pregnancy, when estrogen is through the roof, the vagina can let a 9-something pound baby come out. Like, how phenomenal is that? How can that stretch like that, right? So everything in the body is about stretchiness from estrogen. Well, the bladder, if it doesn't have enough estrogen in its developmental stages, it doesn't have that like elastin. It doesn't have that stretchiness. So the sensors, the nerve sensors in the bladder sense that the bladder is not going to be able to stretch anymore. And then you feel like you have to go to the bathroom because you didn't have enough estrogen. So think about what you can do now. Because if you've been on birth control pills and since you were like 14 or 15, I can't go back in time and change that. But if you're on birth control pills now, if possible, get off of them. If you're using one of the other contraceptives that actually lower your estrogen level, like certain IUDs and implantables and shots, they lower your estrogen level a lot. If that's, if you're on those, please think about another form of birth control, because that is affecting your bladder's ability to be stretchy. So you can also do pelvic floor physical therapy, and they can do exercises and massage. You can do there's electrical stimulation devices that sort of force Kegels and so forth. So those can all be quite helpful. And then you can do what we call a bladder diary or timed voiding, where you try to hold it a little bit longer all the time to try to stretch your bladder. It's like the equivalent of a dilator, only you're using urine in the bladder to try to stretch the bladder a little bit at a time over a few months, so it can hold a little bit more and then a little bit more. So it's sort of like bladder retraining to try to get it to accept a fuller volume so that you can actually go more time between going to the bathroom. It's a real challenge. That's why we need to be aware of the implications in so many different ways when we take away normal hormones and rhythms of young women, and what that really means to their overall health in so many different aspects.
Wow. Thank you, Dr. Gersh, for those comprehensive answers. I think that totally makes sense. So I'm not seeing any more question. There was one thing mentioned, Dr. Gersh, are you familiar with a clinical trial using estradiol patch to mitigate COVID in progress?
Yes, I am.
I'm
And so I think that, and I've been talking about this actually for some time, that estrogen, well, now that you know that estrogen is really important for helping to override, it has so many different roles. One is it helps to override the hijacking of the ACE2 enzyme, so that you can't, when the ACE2 enzyme is hijacked by the coronavirus, the body is impaired in its ability to create the resolution of inflammation. You get stuck like with the engine on, and it's just running and running, but you're not going anywhere. It's like you're in park, but the engine is revving up and you keep revving on that, putting the gas pedal to the floor, but the car is in park. So you're just revving things up. And that's what happens in the body when you get the coronavirus, and estrogen can help to override that. And as well, estrogen controls so much of the immune system. It's like I said, the estrogen controls how you produce inflammatory cytokines, and the control of the lymphocytes and the neutrophils and monocytes, and all these different cells are all controlled by estrogen. Estrogen controls every single aspect of the immune response, both the initial immune response and the resolution. So the question would be, what are they doing in terms of, is the dose right? If you give it to someone who's already sick, is it like too late? Remember, I keep emphasizing, it's all about dosing and timing. So you could do a study using estrogen and it will fail miserably because you're giving it in the wrong dose at the wrong time. So, we'll wait and see. But I'm happy that somebody is thinking about this issue, but it may or may not work out, because if you give it to someone in a small amount and it's already well into the infection process, it's probably not the right time or the right amount. So we'll see, but at least somebody is thinking about this.
Interesting. So Dr. Gersh, it's 104, and I'm seeing more questions too. Do we have more time and I can go through
Sure.
them, or what do you suggest?
Well, I have a little bit of time.
Okay. So I'm seeing that Rebecca Thomas, let's see, I have heard some practitioner will not see relatives of patient ethically in this no and billing insurance wise. Would this be a problem?
Say that again. I'm sorry, I misunderstood
Does
the
anyone
point.
see a wife and husband? I know I have heard some practitioner will not see relatives of patient ethically. Is this a no? And billing wise, would this be a problem?
I don't see any issue there at all. I mean, there are so many family practitioners that take care of the entire family. I've never even heard of such a thing, that you wouldn't take care of both a husband and a wife. Infertility specialists are always taking care of couples, and like I said, family doctors or internal medicine. So no, I don't see any problem with taking care of all family members.
All right.
Now, you always have to honor people's wishes for communication, right? So a patient can say, I don't want you to tell what I'm going to tell you right now. Don't share that with anybody. And then you, of course, you honor every visit is full of confidentiality issues, right?
That's true. So I think we can end here. And my last thing is, Dr. Gersh, if somebody wants to reach you, is this okay to share your information? Actually, I want to let everybody know that Dr. Gersh is our neighbor right here in Irvine.
That's right.
Dr. Gersh, I will share your information just in case somebody wants to reach to you.
I would love that. So my mission in my career is to actually make a difference. So why else would we be doing all of this? We want to share information and help people one-on-one as well. So I try to do both. So you're actually in my office here. This is where I'm sitting, and I'm in an exam room because I don't have a special studio. So this is one of my exam rooms, and I see patients now. Right now, I'm trying to do as much as I can with telemedicine for everybody's safety, but I see patients in my office when an exam is really necessary. And I do telemedicine, as I said. And so I'm here, I'm just a regular working doctor trying to help every patient who comes for my services. And I'm located, like you said, I'm in Irvine, California. My medical group is called Integrative Medical Group of Irvine. And you can also email me at mail@integrativemgi.com. And I would love it if you would all follow me on Instagram. I'm doing an Instagram live show twice a week as well. And my Instagram is Dr. Felice Gersh.
Okay, so I think that was a fantastic. Thank you, Dr. Gersh, for being so patient and answering all the questions in such an in-depth manner and the extraordinary information. So I want to let everybody know this is already Facebook on my page, Sangeeta Shrivastava PhD RDN. This session will remain always. And then please, Dr. Gersh is a true gem in Orange County. So feel free to reach out to her. She's just extraordinary provider and extraordinary human being, actually, that what I learned in
So
the
kind.
last few months. So thank you so much for this. And here we can conclude our session. I think it was wonderful. So thank you, Dr. Gersh. Please accept our sincere gratitude from the bottom of our heart.
My pleasure. Here's a virtual hug.
Yes,
Take care.
virtual hug. Yeah, that we truly need that. So we can totally now close our live session.
Okay.
Right, Dr. Gersh, do you see okay, so do you see screen
Okay.
where you can end? Let's see, so with multiple screen, my many things kind of like it's going somewhere, but I can't see my screen. So if you see, we can end this Facebook Live or something, right? So let me go ahead and start. Okay. Stop live stream. Thank you, everyone. Okay, so we ended and you still here, Dr. Gersh?